Can an anterior placenta affect fetal movement, and how can I monitor it?
Hey there! Welcome to today's video where we'll be discussing the topic of how an anterior placenta can affect fetal movement and how you can monitor it. Let's dive right in.
Understanding the anterior placenta.
To begin, let's talk about what exactly an anterior placenta is. The placenta is an organ that develops during pregnancy and plays a crucial role in providing nutrients and oxygen to the growing fetus. In most pregnancies, the placenta attaches to the back wall of the uterus. However, in some cases, it attaches to the front wall of the uterus, which is known as an anterior placenta.
Impact on fetal movement.
Now, let's address the question of whether an anterior placenta can affect fetal movement. The placement of the placenta at the front of the uterus can act as a cushion between the baby and the mother's abdominal wall. This extra layer of padding can sometimes make it more challenging to feel the baby's movements, especially during the earlier stages of pregnancy. However, it's important to note that an anterior placenta does not cause any harm to the baby or impact their overall development.
Monitoring fetal movement.
Monitoring fetal movement is an essential way for expectant mothers to ensure their baby's well-being. While an anterior placenta may make it slightly more challenging to feel those movements, there are several methods you can use to monitor them effectively. Here are a few tips. Tip 1. Pay attention to patterns. One way to monitor fetal movement is to pay attention to patterns. Take note of the baby's typical active times throughout the day. Try to establish a baseline for what is normal for your baby and notice any deviations from that pattern. Tip 2. Kick counts. Another method is to perform kick counts. This involves setting aside a specific time each day to focus on the baby's movements. Lie down on your side and count how long it takes to feel 10 distinct movements. If you notice a significant decrease in movement or no movement at all, it's important to contact your healthcare provider for further evaluation. Tip 3. Monitoring devices. There are also monitoring devices available that can help you keep track of your baby's movements. These devices, such as fetal Dopplers or wearable baby monitors, can provide reassurance by allowing you to listen to the baby's heartbeat or track their movements. In conclusion, while an anterior placenta may make it more challenging to feel fetal movements, it doesn't pose any harm to the baby. By paying attention to patterns, performing kick counts, and utilizing monitoring devices, you can effectively monitor your baby's well-being. Remember, if you have any concerns or notice a significant decrease in movement, always reach out to your healthcare provider for guidance. Take care and enjoy the journey of pregnancy.